Right, good afternoon. Welcome to this CIPD Coronavirus webinar on health and wellbeing at work. My name is Stephen Bevan and I'm Head of HR Research and Development at the Institute for Employment Studies. And it's a great pleasure to be hosting this webinar. I've been carrying out research and advising employers on wellbeing at work for almost 30 years. And I think we can all agree that the current COVID-19 crisis represents an unprecedented challenge both to public health and to the wider well-being of the workforce. The lockdown now means that many more people are working from home, while others are going to work but are concerned about the risk of infection. The situation raises a number of really complex and sometimes urgent questions from employers. And today we hope to discuss some of these and get some practical answers from an excellent panel of experts. And let me introduce them. First, we have Rachel Suff, who's a policy advisor and wellbeing specialist at the CIPD. We have Professor Anne Harris, who's the president-elect of the Society of Occupational Medicine and a very late stand-in. So thank you very much, Anne, for stepping up. And then we have Emma Mamo, who's the head of workplace wellbeing at Mind, the mental health charity. So thank you all very much for joining as panelists. I've got a few introductory remarks to make. If we can just see the next slide, please. No, not that one with my face on. That's it. Excellent. Just a bit of context, really. So before the lockdown, a third of white-collar workers could work from home, but only about 15% did so regularly. And that number has now massively increased, but home workers may face additional risks to their physical and emotional well-being, such as depression, anxiety, musculoskeletal strain, sedentary working, poor diet, poor sleep, increased alcohol intake, financial concerns, feelings of isolation. Go to the next slide, please. And throughout all this, it's really important that employers remember that their duty of care to employee wellbeing remains in place. But of course, it's a tricky set of responsibilities to discharge once people are working remotely. And that means in an ideal world, conducting physical or ergonomic and psychosocial risk assessments of people's workplaces, including home offices, looking at things like insurance and so on. Very few employers have had time to really do this at a time when many home workers might be exposed to elevated risks of physical strain and challenges to their mental well-being. Next slide. And working at home is a particular challenge for parents. There are over 7 million working parents who are not key workers who also like to have children at home whilst working. About over 5 million working families who have children under 11, and 700,000 people who are working, who are lone working parents who will be working at home. And the HSE management standards point to role conflict as a really significant driver of workplace stress, and that is obviously a risk to many work-at-home parents. So there's a whole bunch of things that are happening when people are working at home, and as this new normal kicks in, that we need to consider. And so today we want to try and talk about some of these things, and we're going to have the following format. Each of our speakers is going to speak for 10 minutes or so, using a set of slides, which they prepared for us. And those of you who are tuning in are able to submit questions as we go along. And I'd ask you to use the Q&A box at the bottom of the screen, not the chat box. And that's the way that you can submit questions. And then we've got some busy worker bees in the background who'll be collating those questions and making sure that as we get through as many of those. And my job really is to help to be the ringmaster. And we hope we'll have some good discussion and debate towards the end of the session after people have done their presentations, and I might even throw in a couple of zingers myself. So my role is as host to keep the discussion going along, make sure that we address as many of your questions as possible, and of course try and finish on time. So the first thing I'd like to do is to introduce Rachel, who's going to give us a few thoughts based on the work that she and her colleagues at CIPD have been doing in this really important area. Over to you, Rachel.
Thanks, Stephen, and thank you everybody for joining. As you're well aware, as Stephen has said, these are exceptional times. It's a huge test of how well organisations are supporting people's health and well-being. Next slide, please. And you as HR professionals, hopefully working with your OH professionals as well, where you have OH in place, you're going to be at the forefront of how you guide your organisation's response to the pandemic. That puts you under enormous pressure to keep up to date with the fast-moving and stringent public health requirements, how to translate those in practice, what that means for your employees to protect them from the spread of infection. And of course, this could be in a very wide range of different workplace settings, as this slide shows. Stephen's already mentioned working from home as one scenario, and then more recently as well, we've seen up-to-date government guidance advising those who are at increased risk of severe illness to be particularly stringent, such as age 70 plus, underlying health conditions, and our panellists will be covering some of these areas in more detail. So the CIPD has said right from the beginning of this pandemic that people's health and well-being has to be at the very heart of how organisations respond at an operational level to it. Next slide, please. So I think it's reassuring, as the first bullet point shows on this slide, that over the past month, when the CIPD and People Management magazine have been regularly surveying the profession to see how they're responding, concern for people's health and well-being has consistently been flagged by them as a top priority. So last week, in our most recent survey, we asked, what would you say is your organisation's main challenge, concern around dealing with the outbreak? The overwhelming majority, from a really big list of different options, chose people's fear and anxiety around the situation and supporting people's mental health and well-being. So that's so important because it's becoming more and more obvious that the risks to people's health from this pandemic, yes, of course they're physical, but they're also mental as well in terms of people's health. There is real urgency, obviously, around protecting people from the immediate risk of infection, but more attention is being drawn now, including by the World Health Organization, into the importance of organisations paying attention to protecting people's mental health as well, because we know that there is an increased risk to people's mental health, even risk of suicide during and after a pandemic as well. Now, we know that from our research at the CIPD, that even before this pandemic, there were significant risks to people's mental health at work. Only last week, we published our annual survey report on health and wellbeing, and it shows, again, mental ill health is the #1 cause of long-term sickness absence. And we had 60% of organisations, HR professionals, saying that they'd witnessed an increase in reported common mental health conditions among their employees. That was before the pandemic, of course, that we surveyed HR, and before the fear and anxiety around this pandemic and all the other associated issues took place. So we can't emphasise enough how important it is to take that holistic approach now to looking after people's health and well-being. And of course, being particularly mindful if you know employees do have in one of those groups that are at higher risk from infection from the virus, but also if they do have a mental health condition. Next slide, please. And I just want to touch now briefly on the crucial role of line managers during the pandemic, and how important it is for HR and employers to provide ongoing support and guidance to them to make sure that they feel equipped to support people in their teams in terms of their health and well-being. Because line managers, more than ever now, are the main link between the organisation and what it's doing to protect people during the pandemic and individuals in the organisation. They're very likely to be the first port of call if people are experiencing any kind of people issue, coping with new work demands because they're working from home, if they need to self-isolate, if they need adjustments to work from home, if they've got care and responsibilities, if they've got concerns, if they feel stressed or overwhelmed. And we know as well from our research that there's increasing expectation generally on line managers to support people's health and well-being day to day. But there's also a stubborn and significant gap between that expectation, which is high, and the level typically in investment in terms of the guidance and support that they receive. So we really need to address that gap urgently going forward. You can see from this slide that there is low levels of confidence generally on the part of HR professionals in the capability of line managers in looking after people's health and well-being, in terms of mental health in particular. So the first stat, 58% of HR think line managers are bought into the importance of well-being. We need every line manager on board. And then 31% think managers can have sensitive conversations, signpost to expert sources of help around mental health, and that's so important now. And then only a quarter of managers can spot the early warning signs of mental ill health, according to our HR professionals. So during this health crisis, line managers have got an acute need to have clear guidance on all the organisational policies that are so important at the moment around flexible working, sickness absence. We've had so many changes around statutory sick pay, for example, isolation, but also how to have conversations with people, make home working work for them if they have got large numbers of staff working from home, and also just deal with all the complexity of some of these situations that people are dealing with. We're certainly not expecting line managers to be medical experts or counsellors, far from it, and part of the skill is with line managers knowing where that line lies and where they really do need to signpost people to more expert sources of help, like occupational health, mental health charities like Mind, and so on. So that is really important. So just on to final slide, please. So finally, we know how extremely challenging this situation is for you as HR professionals. We really are all in uncharted waters, and we're doing everything we can. We're working really hard at the CIPD to provide a whole bank of up-to-date guidance, support tools. We have this hub here. You can see the link to it underneath. We're constantly updating it. So really encourage you to go on that. We've taken down the membership walls. You can freely access all the resources there. And there's also links to all our community hubs where you can go on and share experiences and discuss some of the more difficult issues that you're dealing with. So please do go and have a look. Thank you.
Thank you, Rachel. That's great. Really, really helpful, and lots of great resources on the CIPD website. Okay, so Anne Harris, thank you very much for taking part. Let's hand over to you and hear your contribution. Thank you.
Can you hear me? Thank you very much. Oh, good. So I'm standing in for somebody who was not able to attend at very short notice, and I'm really grateful to Dr. Robin Cordell for allowing me to use some of his slides. Next slide, please. Okay, so I'm going to start by talking about legal obligations on employers, and to some extent this has already been addressed by Rachel. First of all, duty of care under Section 2 of the Health and Safety at Work Act. The employer still has a duty of care irrespective of where that person is working. So working from home, they still have that responsibility. That's supplemented by doing risk assessments under Regulation 3 of the Management of Health and Safety at Work regs, and also the Control of Substances Hazardous to Health regulations. This requires risk assessments for two purposes. One, there is the potential for some workers certainly those that are working in hospitals, to be exposed to this virus, which would come under COSH. And there's also the additional cleaning responsibilities, again, with COSH. Next slide, please. Lots of useful links. I'm not going to go through all of them, but you've got them there for future reference. There's government guidance on the coronavirus, NHS guidance for those of you that are NHS HR professionals. NHS England has got lots of advice, again, for healthcare professionals. NHS employers advice. What will be applicable across all workplaces is the advice from the Royal College of Obstetricians and Gynecologists, which is available at that link. I'm not going to click on the links now. You can look at those later. Next slide, please. So what do you need to do? Well, the government are saying a number of things. To stay at home where you can, only going outside for food, health reasons or work, but only if you cannot work from home. So there are a number of people who cannot work from home, such as healthcare staff, post people, food delivery people. So they are outside of that. If you do go out, what's very important is to keep distance from other people, at least 2 meters away from other people at all times. Wash your hands. I can't say that more strongly. Wash your hands when you have done anything, when you leave the home. If you go shopping, just thinking about shopping baskets and the trolleys, wash your hands afterwards. Don't meet for other people, even friends or family, and you can spread the virus even if you don't have symptoms. Next slide, please. This came through my letterbox on Saturday. I don't know if everybody's got it yet, but you will be getting it. It's the information about staying at home, and the diagram on the right explains what you should do if you get the infection or if you live in a house with somebody that's got the infection. So over to the next slide, please. So protecting those people who need to attend workplaces, these are the key workers. I'm a nurse myself, and I'm very aware of what's happening in hospitals. So healthcare staff are definitely key workers, but we shouldn't forget others, the post workers, food suppliers, waste management people that come and empty our bins, people who are providing news. So it's not just about healthcare staff, although they are very important and close to my heart. Next slide, please. So health and safety for remote working. For those that can work from home, it's a totally new way of working. They're working with computers, many of them, and yet they're not working on a normal DSC workstation. They might be working on the kitchen table, dining room table, on their laps, which raises all sorts of ergonomic issues. Another thing is workload, work-related stress, and that's already been mentioned by Rachel. There's a link there to look at the stress standards. Being aware that there might be more than one person in the household who's home working. So it could be husband, wife, children who are doing schoolwork, or people who are working who are teenagers. Childcare responsibilities. Normal arrangements have totally gone out of the window. We're endeavouring to continue to work and be productive. And for many people, this is with a child or children being around. And managers must be aware and appreciate those difficulties. Next slide, please. Okay, so protecting health and maintaining productivity. We are all trying to do this to the best of our abilities. Lots of guidance here. Government guidance for employers and businesses are available at that first link. Guidance for specific sectors at the second link. And finally, the Health and Safety Executive is a good place to look for guidance and information, that final link. Next slide, please. So from an employer or HR perspective, what's really important is to risk assess, because that will be the way of reducing the likelihood of infection hazards and risk. So just to remind people what a hazard and a risk is. A hazard is anything that might cause harm. So those could be physical or psychological, mental health. And hazards may be physical, chemical, biological, psychological, or environmental. So let's just run through a few of those. Chemical, so those people in healthcare settings, shops, they have to be aware of things like exposure to additional exposure to chemicals for cleaning leads to all sorts of problems with skin, dermatitis. I gather from my friends who are nurses, they're getting real problems with painful cracked skin and dermatitis. Obviously, a virus is a biological hazard, and there are psychological hazards associated with the potential of being exposed to a very dangerous virus. The risk is the chance, the likelihood, and that might be high, medium or low, that somebody could be harmed by these and other hazards, and together with an indication of how serious that harm could be. So thinking about doing the risk assessment, whether that is for home workers or people who are actually working in a physical workplace. And the link at the bottom is an HSE link, which is all about controlling risks. Next slide, please. So risk assessment is part of a risk management strategy. We're looking at reducing the likelihood of infection. So the process for any risk approach is identify what can harm people in your workplace. Identify who might be harmed and how. Then evaluate those risks and decide on the appropriate controls, taking into account the controls that are already in place. Then recording the risk assessment, reviewing it and updating it as appropriate. So if we go to the third point, evaluating the risks and deciding on the appropriate controls, one place that is certainly high risk is when we go shopping. So when you go shopping, the shop owner, whether that's a major supermarket chain or a corner shop selling provisions, they should be thinking about how they can keep people away from each other in the queue when they're shopping, and also be mindful of the effect that they could be having on the employee, in other words, the person at checkout. Next slide. So risk assessment is all about reducing the likelihood of infection, and the UK government approach is available at these two links. So the first one is all about social distancing, and the second one is about self-isolation, so for people in household with symptoms. So the social distancing we've already talked about, keeping at least 2 meters, even further if you can. Next slide. Government guidance on social distancing and vulnerable people is on the first link, and the second one is about shielding. For those of you that are not familiar with shielding, that is the approach to be taken for people who have got serious health conditions which put them at an additional degree of risk. So people who are recovering from cancer, people with respiratory problems such as cystic fibrosis are at significant risk, because if they develop the condition of, if they pick up the virus, then it puts them at risk of a more life-threatening condition ensuing. Next slide, please. So to think about who the various people who are at risk, certainly those of under 70 are at reduced risk, but they are still at risk. So what's important there is to think about social distancing. Those that are more vulnerable, so in the increased risk zone, are people over 70 and people who have got certain underlying health conditions. So that would be issues such as diabetes, or if they're pregnant. And again, they should be even more stringently following the social distance guidelines. High risk are those who are considered to be highly vulnerable. Those are people over 70 with underlying conditions, or those who have an underlying health condition as listed by the government that places them in the more vulnerable group. And that's at the more severe end, who may have more than one condition that makes them particularly vulnerable, or those that are in the last trimester, so over 28 weeks of pregnancy. So the mitigation advice there is social distancing, stringently applied, and further measures as far as is reasonably practicable. So they are certainly the people, if they wish to be home, if they can homework, should be home working. If they're in a high risk job, then the way around that is to think about redeploying them into a different role for a limited period until we get over this crisis. The very high risk are those that are extremely vulnerable, and I've already mentioned that. So being treated for cancer with chemotherapy or radiotherapy, people with severe asthma, so that's people who need hospital admission on courses of steroid treatment, and also people with cystic fibrosis. And they're expected to shield for 12 weeks, which means that they don't even go out of the house. So they stay at home, and they can work from home if that is a part of their job that they can do. Alternatively, you may well consider them for furloughing. Next slide, please. Fit notes for those that are self-isolating. Well, obviously, one place that would be a bit of a viral soup is anywhere where people who are ill are congregating, such as a GP surgery. So the last thing you want to do is send somebody who is self-isolating into that arena. So people who are unable to work for more than 7 days because of the virus can obtain an isolation note through a new online service, and the link's below. Next slide. So what should we expect both now and in the future? Well, as has already been mentioned, and I'm sure it'll be mentioned again by Emma, this crisis is having a huge impact on the current and future mental health of the population in general, and your workers in particular. So the best thing to do is think about making plans both now and also when the crisis has reduced and people are able to go back to work. Think about what your occupational health provision is. If you don't already have an occupational health provider, there are many organisations that can actually do that for you if you don't have an in-house one. Next slide. Oh, there we go. Sorry. That's the end of mine, and Emma Mamo will be taking over for the next section.
Thank you, Anne. That's great. So over to Emma, who's going to talk about supporting the mental health of staff.
Good afternoon all. Thanks for inviting me to be part of this, and thanks to Rachel and what they've covered so far. So I'm Head of Workplace Wellbeing at Mind, and I been focusing in this area of work since 2010, but I think what we've seen in the last couple of months and couple of weeks and so on is as we said, unprecedented. And equally, I've had to respond that as a leader of a team. I've had 40 people go remote, and what I've had to do to kind of support them and myself during that transition. So I'm going to be covering general guidance, but also hopefully through the questions and discussion I can bring in my personal experiences. So next slide, please. So with Mind Mental Health Charity, we're here to make sure that anyone experiencing a mental health problem has somewhere to turn for advice and support. And this time, you know, it's as we said, it's hitting everybody in terms of their mental health. We're all on a spectrum, but thinking about the needs of people with mental health problems and the additional challenges this will be creating, but then equally, as we said, the impact this will have more broadly on everybody. Next slide, please. Yeah, so I just wanted to talk a bit more about that current picture. So next slide again, thank you. So we've talked about this outbreak and how it's cutting across, you know, physical and mental health, but also linked to this as other areas of well-being, so financial well-being, social well-being. I think that it will be impacting people's mental health in different ways and at different times, but I think in multiple ways. I think we're all worried about the financial implications of all of this. It's also making it harder for us to do the things that we know keep us well. So that added challenge in terms of, you know, exercise, social connection, and so on. And that's not to say we can't still do these things. It just needs to be done in a different way. But I think, as we've already mentioned by other speakers today, just the anxiety of this kind of pandemic, what people will be experiencing potentially around bereavement, but equally for the people working in frontline services, what they will be experiencing in terms of trauma. So yes, this is very much a significant worry in all of those areas. And then thinking about workplaces specifically. So next slide, please. So we touched on these groups already in different ways, but for me, it's absolutely thinking about who's working from home now, and equally if they've worked from home before, okay, that's a good thing. But then thinking about how this is now your new normal for the foreseeable future, and how someone's mental health is supported during that. But for people who are new to working from home, obviously this is a real step change and a real disruption, and something that we've all needed to adapt to quite quickly. And then equally the additional emotional challenges for people who might be in the high risk or vulnerable kind of groups, and who might be having their life just disrupted and restricted even more so. So thinking about that. We've talked about key workers, and yes, it is very much about NHS and social care and emergency services on that front line. But also it is people who are delivering goods, supermarkets, corner shops, BT engineers and so on. So I think trying to think through how you support people doing those roles and having to come out of their home, and thinking about the increased risk for them, but also what they might then be taking home. And I'll talk about that in a bit more. And then obviously employees who are being furloughed, and the psychological impact of people going through that and supporting people. But equally thinking about staff who are maybe still in the workplace if you're not furloughing all of your staff, and thinking about how you manage the different needs within that. And then equally, we know a lot of industries which have had to shut down for the foreseeable, and people are being made redundant. So again, thinking about how you manage and support people through that process sensitively. And I think for some employers, you actually might have employees in all of those groups, and thinking about how you manage the needs within that is quite challenging. Next slide, please. So in terms of how to respond with something as new as this, as challenging and kind of wide-reaching and fast-paced, I think you have to go back to thinking through more of a principles-based approach to help inform, decisions taken, actions that are being taken. So for me, first and foremost, it's about supporting people's well-being. And it's great to hear from Rachel that HR professionals are absolutely recognising that the well-being and equally the safety of people within that needs to come first, and an acknowledgement that people's ability to engage with work will be impacted at certain times because of this, because of personal reasons, stress and anxiety, distractions, and real worries and concerns about friends and family and themselves. So I think managers and people managers and supervisors will absolutely play a key role in that, and you'll need to understand people's individual circumstances and understand the ebb and flow of how people will be responding. For me, the next key principle, and I've definitely been trying to model this with my team, is just clarity about priorities in terms of responding to coronavirus, but then equally what you might need to be doing in terms of business as usual, but just being really clear about priorities. And I guess a very agile appraisal of that, because if it's anything like, what we're experiencing, things are changing, and you have to be very agile to manage that. But in order to be agile, you then need to have policies and processes that are clear for staff, that have been updated in light of all the changes that we've seen. And for me, it's about a real focus on simplification. So anything you can do where it's a one-stop shop, everything's together, you're managing communications and updates to your workforce and so on, is really important. Which brings me on to the next principle around community. So we know a protective factor for people is around social capital, which is jargon for friends and family, colleagues, a support system to draw upon. So thinking about how you can create that community and manage that community in your own workplace is really important. We're obviously very concerned about the mental health impacts of the pandemic, and what we've seen so far is people are doing okay, but I think it's because there's been a real sense of togetherness and community that's coming, and how everybody's responding, and I think that's been a good protective factor. So thinking about how you can support and create that within your own workplace will be important. And then the final point in terms of a key principle is just about being reflective. Obviously this is something that needs an initial response, an emergency kind of response to, but then thinking about how, yes, you need to spring into action, but how can you also think and build in pause so you can reflect on what's working, your staff can share what's working. This is very much a test and learn type of situation. So I think how you can build in those feedback loops will be very helpful. So moving on to the next slide, I just wanted to focus a little bit around employees who are working from home, and then equally around key workers. in terms of the key issues that we see that need managing and responding to. So this idea, we've always been concerned about remote working, agile working, and how this can lead to an always on culture. So supporting people to manage their working day and come up with a working day that works for them. And this is especially key for working parents. So thinking through how people can have a routine and clear boundaries for their working day. I guess the challenge is that we know a lot of people are working in different ways now. So the working day is not a uniform 9 to 5, and people will be working many different kind of working styles and patterns. So I guess as HR professionals and line managers, it's being clear and supporting everybody to work in a way as a team or across an organization. So I think it's about contracting and just everybody sharing what their working pattern is. And I've seen people putting things on their email signatures, explaining what their work, how they're working. So thinking and being mindful about that. I think the other thing is around system overload. At Mind, we're using Teams. Some people are using Outlook. People are using both. So being clear with your staff about what systems and platforms are being used and for what purpose, and just having, information about logon details easily accessible, and just trying to think through and stay one step ahead and support people working in a very different way and needing to be a bit more fluid. The next point is obviously around access to support. In a workplace, you can grab colleagues for a conversation, you can speak to your manager. There's a lot of things that are now available to support that in a digital format, but I think you do need to make sure regular check-ins are scheduled and kept to in a format that works for each staff member. The next point around burnout. So I think, again, being clear and supporting people with their priorities and offering flexibility, as Anne already mentioned, and Steve, that staggering figure of 7.2 million working parents, and thinking through if someone's a single parent and having to home work. So I think supporting people around that is important. And then isolation, absolutely having channels for doing work, but I think you should also set up channels and discussion routes so people can have that more social side of the workplace, and contact with each other is important. Moving to the next slide, please. So thinking about key workers, as we said, this includes quite a wide range of people in workplaces, but obviously if people are out and about, they will have higher exposure to the coronavirus and so on. So ensuring adequate safety measures are in place and clearly communicated to people. If people are working on the front line, and we've heard, about the impact of trauma. We've done work previously with the emergency services through our Blue Light programme. So just making sure that adequate and appropriate support is available to people so they can talk about what they've experienced and process it, and then get more specialist support when it's appropriate to them, but making sure people are aware of what is available. And then thinking about more broadly, as we said, people in supermarkets, they might be having to manage potentially challenging situations if everybody is feeling the stress and concern. Obviously, emotions can run high, and that may mean they're dealing with some very challenging situations on a more frequent basis. So supporting people through that, offering peer support and opportunities for people to debrief is so key. And the next point, if people are having to work quite intensely, and I suppose this is true for people working from home as well, just making sure you're encouraging people around self-care before they come onto a shift, during a shift and after. So doing check-ins before a shift so people are mentally ready for it and the challenges they might be presented with, making sure people are taking care of their hydration and eating well during a shift to help manage that as well. And then also helping people switch off as they come to the end of the shift. It'll be obviously more difficult considering how tough shifts are for people at the present time, but just helping people to think through how they can switch from the working conditions and then going into home mode, if you will, just so they can have that time to recharge, which will be so important during this time. And again, looking at burnout in terms of staffing levels, if people are more exposed to the virus, and then maybe more people are having to take time off. So just making sure you're aware of staffing levels and having regular check-ins. Next slide, please. I think that might conclude me. Yeah. Thank you.
Brilliant. Thank you, Emma. That was really comprehensive, covered lots of territory. So thank you, all three of you panelists, for your contributions, which are all really interesting and certainly have prompted a large number of questions. And we've been trying to sort of cluster them together Probably the one that's come up most frequently is around display screen equipment. So I might ask Anne if she could have a think about this. There are several dimensions to this, it seems, from the question. So obviously, a lot of people, particularly have been working at home for only a short time, relatively hurriedly have had to work at home with laptops and so on, not all of whom have got office equipment. They're using their own equipment and so on. There still is this requirement to do ergonomic assessments. And I think people are concerned in their questions about how they should do this, particularly if they're not trained. What sort of guidelines should they follow? What practical things can people do to make sure that people aren't being exposed to risks? One thing I just would add is that my organisation, IES, is about this week to publish some new data, which we've been collecting on musculoskeletal risk. Somewhere between 40 and 50% of people we've been surveying just over the last 2 weeks have said that they've got more pain in their neck, shoulder, wrists and back than previously, prior to starting home working. So we're seeing quite a significant increase in exposure to this. So it's probably not a trivial question to ask about how employers should think about doing a risk assessment along the lines of the HSE guidance.
Okay, should I answer that?
Yes, please.
Right. Go to the Health and Safety Executive website. There's lots of information on there. There's a very good little pamphlet. I don't have a copy of it in front of me to give you the title, but it's got pictures of people sitting at a workstation, and you then answer a question next to it, and it gives you a picture of somebody with a poor setup, say in relation to using their wrists and their fingers and their hands, the seat, the height of the seat, the type of the chair. They can use that. It's very straightforward. They can just go through it and tick the answers, and then it will give them information about what's wrong with this setup and what's right with that setup. So that's the first thing. Maybe it would be a good idea for the organisation to produce a sheet that they can send by email, identifying the kinds of things they should be looking at. So things like, have you got the right height of chair in relation to your keyboard? Now that is a difficult one because people are working at home very, very quickly, and they've not been able to necessarily get the right equipment at home. So it's a case of doing the best job. But if they're aware of what the best job is, the best positions to adopt, that will certainly help. Breaking up the tasks is quite an important part of that. More difficult when you're working from home. If you're in the workplace, you would have natural breaks. You'd be talking to colleagues, you'd be going to meetings. Now, all our work is being done for many using their computer and doing webinars or doing Zoom calls. So perhaps some guidance from the employer to their staff about how they can break up their work and how they can best position themselves when they're using their keyboards and screens.
Thank you, Anne. That's really helpful. I might also ask a related question of Emma about doing risk assessments of the psychosocial work environment at work, because obviously there is a requirement, although not many employers do this. But are there sort of good tools available? Does Mind have any? I think the HSE obviously has some as well, but a couple of people have asked questions about doing risk assessments of people's exposure to an elevated risk of developing mental health problems.
Absolutely. The Health and Safety Executive obviously have their risk assessment, and I would refer people to that in terms of how to conduct one. In terms of tools that can help people with managing their mental health, and then thinking about how you take account of the coronavirus and the additional impact of that. I mean, we've always promoted the use of wellness action plans, and I think they're good as a proactive tool and a reactive tool, and I think they could be hugely helpful to get people to think through what are the things that keep them well at work, and equally, you know, how does that change now? What are the things they may have traditionally done which may be more difficult now, but how can we come up with a different way of doing that? So to get people to think through what are the things that will keep them well, and then getting people to think about what might cause them to struggle. And again, this might be different to how it would be in the workplace and doing their job normally. So getting people to think through what they might find specifically challenging, and then again to come up with ideas and solutions about how to manage that, and then to think through what support will be helpful from their manager, what support they need to put in place for themselves, and then what to do if their manager is worried about them. So I think in terms of people, if they had these in place already, you absolutely need to review them in light of how we're working now. But if you've never had one in place, I think this is a really helpful framework to get people to start thinking this through. And as ever, it should be a living document. As we go into this, you know, I'm reflecting on it myself in terms of how I've been working. I'm very strict now in terms of making sure I have a 2-hour lunch. I'm breaking that a bit today, but I've got a light afternoon. But I think this is very much an evolution and understanding how we work in this way and what's working and what isn't, and having a kind of document that you've agreed with your manager that you both can discuss and review as this time goes on, I think would be hugely helpful.
That's great, thank you. I think your point earlier about self-care also really, really important.
Yeah.
A question perhaps for Rachel. We've had a few sort of questions about working arrangements and so on. Perhaps if I put two together, you might want to see which one you fancy. There's one about furloughed staff. And obviously an employer still has a duty of care over a furloughed staff because they're a member of furloughed staff because they're continuity of employment and so on. But any thoughts about how employers should think about the well-being of people who are on furloughed, or even if line managers are being furloughed? I think was another question. And then a second question about annual leave, about people concerned, it seems that people are going to be saving up lots of annual leave. Once everyone comes back to work, we're going to end up with lots of people carrying leave over. And obviously, you know, what's the boundary between being a home worker and being on annual leave? It's rather blurred. Any reflections on furloughing and on annual leave?
Yeah, thanks, Stephen. Really important areas, both of them. So I think in terms of furlough, it's taken a while to get real clarification on some of the detail around the government's new job retention scheme. And I think on the face of it, it might seem really attractive. Oh, we're offering 80% of pay and so on. And I mean, it's a vital financial support for people, but also, as you say, it's really important to remember that employment rights continue through that period of furlough, as does the employer's duty of care and so on, for health and safety and well-being. So whilst that furloughed employee isn't able to carry out any work for that same employer, you can carry out training. And actually, employers are encouraged to encourage their furloughed employees to carry out some training, because I think it can be really unsettling for people to be furloughed, because it's a really new situation. You don't know what the future holds necessarily. You might be worried that you'll be at risk of redundancy. And also, whilst there are all these difficult challenges to people who are now shifting their work to working from home and all the sort of issues and new demands that throws on people, at the same time, if suddenly people are furloughed, and I know quite a lot of people who are, they've suddenly have nothing to do. They've had their, you know, and work provides purpose for people, as we know, so they're in a limbo. So it's really important that employers are mindful of their health and well-being at this time. And the question about line managers, it's a good question. If a line manager has been furloughed, who then is looking after and managing and supervising that employee? Because I mentioned earlier how line managers are such an important link between the organisation and the people. Everybody needs to have a manager that they can turn to at this time. So without overburdening other managers, the employer needs to think about realigning those line management responsibilities. In terms of annual leave, just quickly, we could have all sorts of different scenarios around annual leave, because on the one hand, the working time regulations have been changed so that people can carry over their annual leave entitlement to subsequent year, but that won't apply if actually people are using up all their holidays. So we could have some employees stacking up quite a lot of annual leave entitlement, whilst others are left with hardly any. So I think there needs to be those individual conversations with employees to think about how they manage their annual leave. It is a good solution to take paid annual leave, for instance, if you're looking after children and so on, but we don't want the rest of the whole year to go by with people not having any annual leave to take. So really think about the impact of that in the round on people.
Lovely, thank you. There's a couple of other questions I think a combination of you perhaps could begin to address. So one is about people who are living with people who may be especially vulnerable. I think Anne covered a bit of this in what you were saying, but there have been a couple of questions about, you know, what sort of provision should there be for, you know, how do we support people who are working at home but are also living with people on the extremely vulnerable list?
Who's that directed to?
Can you repeat the question?
Yes, there's a question, sorry Anne, this is directed at you. Guidance for people who are working at home but also living with people who are vulnerable to infection, particularly those on the extremely vulnerable list.
That is a really interesting question, because the very vulnerable person is going to be at risk if the partner or the other person that's living in the same house is leaving the house to collect materials or to get shopping. As far as protecting them in the home working scenario from their manager, the manager should be aware of the stress that puts them under. Could you just hold the line a second? Can you stop? Did that help? Hello?
Thank you. And I think also if people just check out the links that you've had on your slides as well, I think there's quite a lot of other guidance for that might cover some of that question as well. Okay, I've got a question about sleep. One of the challenges I think that a lot of people are facing is about interrupted sleep, poor quality sleep, and so on, affecting people's ability to concentrate, people's levels of fatigue, if they're working parents, if they're looking after elderly relatives and so on. I'll open it to anyone really wants to answer the question, but it does seem to me that there is some evidence emerging that people in this situation, because of all sorts of concerns, not just work concerns, are having trouble with sleep. Any thoughts or any resources that you know that you could direct people to about that?
Sure, shall I respond to that? There's such huge links between people's sleep and mental health. If someone is struggling with their mental health, one of the first things that will be affected will be someone's sleep, but equally if someone's struggling with their sleep, this can then obviously impact on their mental health. So it's interesting, Mental Health Awareness Week in May this year is focused on sleep, actually. And I've been experiencing it myself a little bit, just in terms of being able to shut off of a night time. So I've just taken to just journaling anything that I'm worrying about, just so I can get it out of my mind, and then trying to do some kind of relaxation techniques to try and help me get to sleep a bit easier. I think also thinking about a routine and trying to go to bed at the same time, and just, as I said, more broadly, just trying to think through what your daily routine needs to look like, and equally what your kind of going to bed routine. And we always know switching off your devices and not using your phone as an alarm clock, and all of these things can help with your sleep. There's a lot of information out there, and I'm happy to share stuff after the webinar if that's helpful, but there's a lot that you can try and think through to help you in terms of switching off a busy mind as you go to bed, and then the kind of conditions that you need around you to help you sleep well.
Thanks, Emma. And perhaps another one for you, Emma, is around domestic abuse risk. We're hearing a lot about that, and obviously, you know, that's a big concern. And as more people work at home, that's again an elevated risk of people being exposed to that.
Yes, I mean, that is a really difficult one. And I think it's also in terms of many children who are maybe still attending school because there are concerns that they're in unsafe households and situations. And I think that is potentially a heavy burden for workers, in educators and so on to bear. So I think having an organizational conversation about that and very clear processes around signposting is one thing. In terms of adults and if they're at risk of domestic abuse, again, I think this is a challenge, and for HR professionals to be aware and responsive to this and having clear information signposting. But I think this is again another challenge that we're starting to think about and need to respond to.
Thank you. We're nearly up to our time, but time for a couple more questions, I think. Anne, I think some of the questions are suggesting that we're focusing quite a bit on home workers, which I think we have been, but wanting to give you the chance to talk about non-remote workers, key workers and so on. You've talked about the NHS and so on. Any particular things that you want to talk about with them in relation to how we can provide support and make sure that, that we're doing proper risk assessments for them?
Well, certainly from the perspective of healthcare workers, because they are at the front line, what's really important for them is that their managers are aware of the psychological issues that poses to them, and the need to have the appropriate personal protective equipment, which is certainly being looked at the moment. As far as people working as post people or waste management people, then they should be aware of the infection control issues, the distancing rules, the importance of washing their hands. If they could be given some alcohol rub to use on their hands when they've done any high risk activities. So if they've touched a door or touched a bin, when they must be aware at the end of that working process that they should wash their hands if they can, and if not, to use some hand rub.
Excellent, thank you. Very quick last comment for Rachel, perhaps, on financial well-being. Some people are asking questions about pay cuts and furloughing and general anxiety around financial well-being. Do you want to say a few things about that and perhaps some of the things the CIPD have done?
Yes, and before I answer the question, do go to our website, because we have got some really good resources around financial well-being, because it's really important at the moment. I mean, people have got so many different worries at the moment, depending on what their own situation is. But financial worries, we know, is already a source of mental distress and mental ill health amongst a lot of people now at the moment. I mean, literally, not overnight, but very quickly, a lot of people have had their incomes, or the prospect of their incomes just disappearing overnight. I'm sure we all know people who are in that situation. And even if you're on furlough, you'd probably be worried in the future. And we've done research at the CIPD showing that a lot of people would struggle even after a week to meet their bills and so on if they were put onto statutory sick pay. So very real concern. And it's important to do things like signpost if you've got an employee assistance program that has debt counselling and financial advice. So all that practical help is really important at the moment as well, and make sure you give people in that situation as much signposting and information as you can. I mean, the schemes are there to access, that government's made available, but we know as well that some people are going to fall through the cracks as well. If you don't become eligible, for example, your earnings are too low for statutory sick pay. So there is the universal credit option. So know what the options are for the schemes and how people can support access financial help, and be as generous as you can as an employer in terms of your support as well. We know it's tough for a lot of businesses now.
Brilliant, thank you. Well, we've come to the end of our time. I'm really sorry if you've asked a question that we haven't managed to get to, but thank you so much for sending them in. We're trying to cluster them together. So I hope we've managed to represent the range of questions that you had. I'd like to thank our three panellists, Rachel Suff, Anne Harris and Emma Mamo. And actually the four organisations represented here are a good source of information about health and wellbeing at work. So please do access all the websites: Society of Occupational Medicine, CIPD, Mind and the Institute for Employment Studies. Thank you all so much for tuning in. This is going to be a continuing area of interest, and I know that the CIPD is going to be continuing to do work in this area so that it can keep the HR community and other people who are very interested in this as informed as possible. So thank you all very much for tuning in, and enjoy the rest of your day.
Thank you.